welcome everyone. Let's start first of all by maybe just a few brief introductions. If you could tell us who you are, and secondly, if you could have any job starting tomorrow, what would it be? Ola.
Yeah, thank you. Yeah. So my name is Olani Alabi. I'm a person living with disability. I'm a Black African. And if I was to have a job in the future, I would like to be a head care worker, because I love what they do. They work selflessly to provide service to humanity. It's not that the pay they get is massive, but I just enjoy the way they put their strength and everything into the job that they do to make us live a healthy life. Thank you.
Yasmin?
Good morning, everyone. So, my name is Jasmine Vega. So, I'm from Latin American background. I would say life experience is so important. So, to build your skills into the benefit of the society. I will say that right now, I'm doing something that I think contributes to the society in a positive way. Mm-hmm. But personally, I would like to have different perspective job, maybe more into the community, just to help people with neurodiversity.
Mm-hmm. Is there any particular job, any particular dream job that you would like to start from tomorrow?
Maybe because also I have long-term conditions. Mm-hmm. I think it will be good something to combine, probably remote, both sides, remote, and also just so be more flexible.
A hybrid
exactly,
job.
To allow me to just myself.
Okay, great. Right. Tell us who you are, and if you could have any job from tomorrow, what would it be?
Okay, my name is Lily, and I live in temporary accommodation by Southwark Council. And another thing, if I could have any job, I prefer IT or remote or working with children, because my previous work was working in a school. So I would love that, because it's the flexibility as well, working with around kids, and it will work around with my kids. Mm-hmm. And long-term illness as well. Because of that, try to work around this situation.
Okay. Wow. So Lily, could you maybe help us to get a little bit deeper into the topic now, and tell us what would be the biggest barrier for you? What would be the biggest difficulty for you in finding work or keeping work?
Both at the moment, because the school I work is closed down by Southwark Council, so it would be nice to work around where my kids' school, near to my kids' school, because secondary school, and would be easy for me, or out of the barriers, that working near to the school, and also my kids doesn't have to travel long,
right,
morning and afternoon. That will be a big change. Mm-hmm. And I would like that would be change. I'll be hopeful, and that's my biggest barrier. But the solution would be the government or the council change this situation, what we are in. I know it's hard, everywhere here is not good, but the positive outcome would be nice, that my kids closer to their school and the home, and also me working, because as we speak, I'm a volunteer as well. So I would love to give the community, by volunteering continuously. That's what
Right. So the distance is a barrier because of
Yes.
the responsibilities that you have
Yes.
with caring for your children,
Exactly.
and then
Because
having to fit work in as well.
yes, because the timing, you waste your time by back and forth, and all the community I have, the help community is near to my kids' school, and that's my community as well.
Right.
So it would be nice, around there.
Yeah.
Would be helpful.
Yeah.
And the job I would like I said, IT or remote, or specifically I would love to work with kids, because helping, and also I would love to help like elderly people as well.
Okay, we'll come back to that. Ola, can you tell us what would you name as the biggest barrier for you in terms of finding work or keeping work?
Yeah, thank you. For me, and I speak for other people living with disabilities as myself, I think the biggest barrier, or some of the barriers that we face, is the lack of reasonable adjustments by employers for disabled people. Employers should be, supported to provide reasonable adjustment for people looking for work who are disabled, such as making adjustment to their workplace, workstations, access facilities such as lifts, providing assistive technologies for people who are deficit in speaking, and people with neurodiversity, and also lack of training as well. Training, like providing training such as apprenticeship, internship, or actual training for disabled people. So
is that something you feel that you need?
Yes, this could be very good, so that I could get into the kind of job I want to do. Without being restricted because of my disability, and that's ensure inclusivity as well, like make me to be like being seen as part of the society, and also transportation as well is also a major concern. Transport should be provided for disabled people, accessible transport. The buses, the tubes, the walkway, the curbs should be adapted to make disabled people have access to transport without hindrances. There's a lot, support for charity organizations to support disabled people in the community as well would be very good. Yeah.
What kind of training would you be wanting for yourself?
For myself, it's the kind of prospective job I would like if I could. Support to go to university and study healthcare related courses, and be where I want to be here. Yeah.
Is that something that you've already explored?
Not at the moment.
Training in the care
moment.
Professions?
Not at the moment, but this is what I propose to.
What you would aim for?
Yeah. Thank you.
Okay. What about you?
I think I will start with probably right now the government. So many places there are awareness of neurodiversity, but I think it's not applicable in reality. So it's that is more link and realistic adjustment. I think there still is a lot of things to work on it. And especially me, because I tried to change my career. I finished health and social care, and it still is really tough. It's not accessible, and I will say that one of my biggest barriers is when I'm doing the application. Just websites, like I have so many resources out there, but it's just overwhelmed. And especially I have dyslexia, so it's is very complex. I think they should make it easier. The applications, even the description jobs request, like is easy in a way, like for people as a neurodiversity thinking, just to be more comfortable and just be more mindful that okay, so I can apply this, I have these skills. Realistically, I can maybe move forward to that.
So you feel that you have the skills, but you're not able to find the right work?
Yes, I think, like through my lifetime, I've been gaining few skills, and I consider that, like it could be beneficial in so many ways in terms of the society or companies, but it's just the fact that when I'm facing just the application, it's really difficult. So it's not easy for me, because then you discard like automatically. They asking for so many things that you just literally, okay, maybe I'm not gonna fit in that. Possibly you lose the track to improve your life, or just keep going. Maybe motivation that obviously when you face as well like that. Okay.
Do you feel comfortable when you're trying to make the application? Do you feel comfortable telling the employer that you have that difficulty, that you're
initially it was a little bit probably because recently, not that long ago, I just found out that I have dyslexia and dyscalculia, so it's the same with letters that is with numbers. So it's a little bit more complex. And it's true, like even though you try to be conscious about it and digest all the what you have, it's a little bit complicated in a way that you feel like probably you are not on the standards, or you are not capable in some like profiles, like companies' profiles. So it's like maybe less competitive than others, because directly you are conscious that you have that condition, to say that. So it's limited you in different ways. I would say that.
Do you relate to that? I mean, you were talking about the healthcare profession as well, but do you relate to what Yasmin is saying about disclosing your conditions when you're applying for work? Do you feel comfortable with that?
I mean, speaking generally in perspective, employers, I think I think the government itself should enforce the Equality Act on employer, so that they are,
of course,
so that, I mean, the disability awareness or disability friendly employers, so that when they put up their applications or job applications, they make it, I mean, not the general one they do now, they should make it like an easy read one for people with disability, so that you don't have to go through rigors of filling forms. Yes, I agree with it. So, I mean, yes, I mean, there are some jobs that disabled people can do, but there should be like, I wouldn't say equality, I would say equity. Like you make things
equity
rather than equity. So you make, I mean, if I can't do this job, there should be other jobs that I can do that fits into the role that you're looking for. So that brings a bit of inclusion in the community.
Okay. What about you, Lily? When you're applying, when you're looking for work, do you disclose? Do you tell the employer at the beginning what your situation is? Do you explain it from the beginning?
It depends on, just like both of them they said it, but most of the time when there is application online, when I do, the question is, some of them I don't even understand. Some of them, not relevant. So some of the question, it asks you that, do you have any problem, this, health issue? And by last week, I did 5 of them, and I did five of them. I told that I have health issue.
Right.
And the health issue I did, sorry, at the moment this work is taken. And the other one I didn't. I have phone calls. But you see the difference?
Oh.
Because when you tell the real you, no, because I understand, because they don't know me, or they didn't see me in real life, what I'm capable of, but they can be bothered, because that's it. As far as they're concerned, they can see in the application what you put on. So that put them off. The same like when you see something, sometimes we say that, when you say, oh, I don't like that, we say that, because we don't feel comfortable, some of the stuff, the same thing. So, like he said about apprenticeship, for example, because recently, like I said, the school I work is closed down, but I was kitchen assistant, and also at the same time, I do lunchtime supervising the kids. And I would love to continue that because of the kitchen work. I can't do it anymore because of health issue. But with working the kids like lunchtime or supervising them or like working TA, I need that qualification. Even though I have the other qualification, but if there is apprenticeship or things like that, if the government do, and I know I saw online, it doesn't take long as well, because you're just topping up what you have, you're just topping up. And you're giving back to the community, like both of them, they want to do the same thing I want to do, but it's impossible, because as soon as they see, oh, you have this qualification, but you don't have this one. But, I can't do the things, what they're saying, but it just, you need paper.
Right.
So, but that by itself is barriers.
So the qualifications
Yeah.
are going to become a barrier, but also if you're making the application,
Yes.
you feel that your health condition is also
Exactly.
something that is holding you back.
Yeah. So you have to, to move forward, it would be, and, because I've been working with them 5 years, I want to continue. And by itself, when you lose that, connection, you feel still I'm active doing the voluntary, but I want to get paid as well.
Because volunteering is also experience.
Yes,
isn't it?
experience. I had that as well with the school, my kids' school, and 4 years that while I was working, at the same time I'm doing volunteer. After works, I do volunteer. So I said, when I had interviews, I said, I'm qualified more than the people who have degree diploma. I'm talking about, the work related with the schoolwork.
Okay.
But I said, because I see that when I volunteer, I see the people, the one they have. I'm not saying I'm perfect, but I see the difference. Because you are the one who's spending more time by volunteering with the kids. The people just came from, university, or they don't have that much experience unless they go to as a voluntary or apprenticeship.
So the apprenticeship is the apprenticeship not available to you?
I try, I apply. I haven't received any yet.
Has anybody else had experience with apprenticeships, applying for apprenticeships?
I haven't tried, to be honest, because I think they have, as far as I know, they have the age gap, so it's restricted to 25, if I'm not wrong. Probably they change now, but so normally I was trying to get the experience, rather than anything else.
So the apprenticeship and the training is capped for a younger age group.
And obviously, for people like with probably our age is more challenging. So automatically, you don't fit in there because literally it's the age. So it's less opportunities, I would say.
So that's another barrier that is, you can't control it. You can't control your age.
Exactly.
Yeah.
Unfortunately.
Okay. All right. Let's try and sort of think now about some solutions, I think that maybe for each of your individual situations, you've probably got an idea of how this could be fixed. Let's talk first about how it could be fixed. Then afterwards we'll talk about maybe who could fix it. We'll do that afterwards. So how could your situation be fixed? Let's start with Yasmin.
I think we mentioned before that it's just the adjustments, like being more a person-centered approach, and like being more realistic. And I think companies, they need to get like more training regarding disabilities, neurodiversity, because then they can take the best out of that person. So I think everyone, we have skills, we are gonna be like capable and compromise obviously with the job that we do. But I think on this side we need someone or like few policies that encourage and take the best of that person in terms of productivity and fit it in. So, and then obviously as a person you will feel like more I would say profitable and just useful for the society, and obviously with yourself being happy, saying, okay, I have this condition, I'm gonna try to blend it in, but still I'm working, I'm just, getting my money, because it's everything just comes after financial situation, mentally stress, so it's impacting in so many ways. So this one I will say.
Being valued, I think you were talking about that before, Ola, weren't you? What would the solution be for your situation, for you to feel more valued as an employee and to gain
thank you.
employment?
For me, I would just say the solution for me is that the employer should be more disability aware. They should get more education about disability, because there's this general bias or stereotypes about disabled people that they cost employers more money. Employer doesn't want to spend money. I mean, adjusting your workstation, providing equipment, and these are the things that the government should look into. If it's reasonable for them to grant employers more access to funding to support with this reasonable adjustment, adaptability for disabled people, and also to, create this culture of making every people, feel valued. People should be looked at as individual, not generalized. Yeah, that would be very better for disabled people. Like, you're tailored to see what you can do and not what the employer wants you to do. More flexibility for disabled people. If I can't go to work today, maybe that work I can do it from home. I'm still productive, instead of wanting me to come to work every day. And sometimes I've got my downtime, and I'm not able to get to work. Yeah, there should be a way for me to work from home if possible. Yeah.
So valuing your input according to your capacity for your physical capacity. How about you, Lily? What solutions have you come up with? What's on your list of solutions?
Just like you said, would be nice that the employer adjusts the problem or the issue we have, so it can work around. And also, like, the government give this, like she said, not the age gapping. So we matters as well. We're bringing kids into this world, and also we need to be valued as well. Not like we're not there. It feels like you laid down and you're not feeling that kind of nobody cares. Sometimes, like you said, sometimes you can't do it. You have lots of mental issue because of the situation you have, but you push that, you come out to do that thing so you can move along and to see the future will be it will be good, it will be better if we came together and the government give more fund, not only that kind of the age we have, more for us to work around and close to where we're comfortable, there is physical or mental issue, consultation. That would be a solution for me and more
support.
Yes.
Okay, great, thank you. Just to finish off then, I think we should say who needs to take action here, or what action do you think that decision makers could take right now, today, immediately, to improve your situation, to make a positive difference to your situation? Give me an action.
Funding.
Funding?
Yeah.
Training, yeah.
Training for you or training for them?
For them.
For them?
Yes.
So the awareness training
The
that you were
awareness
talking
training,
about.
yeah.
That would make an immediate difference. Ola, what do you think would make an immediate difference? Something that decision makers could do?
The decision makers or the government policy makers, I would say they should, that there is, whatever they want to say or do about us, nothing about us without us. Like these policies about disability should be, disabled people led, like co-production, like with disabled people, so that whatever policies they're making, disabled people are in it. We're leading in it, so we know where, we have the lived experience. We know what it feels like to be disabled, so that we can co-produce policies, so that employers can inculcate in their whatever organization policies what they need to do for disabled staff. Yeah, just to make every employer disability aware, disabled friendly, yeah.
And this is not something that you've ever been invited to be involved in, is it? Have you been invited to advise policymakers?
At the moment, I'm a nobody, so maybe, maybe in future, if the government is serious about.
That's a very strong statement to make. You feel like you're nobody? You're not a nobody.
I know, but my voice, I don't think is valued at the moment, but I don't know if in future the government wants to make policies and get disabled people really involved and gather disabled people around the community and get us into action so that we can support them in making these policies. Yeah.
You want to be part of that conversation.
Yeah.
Valerie, so I was just wanted to add that I think the government needs to be more strict in a way that they have the data of people that will have different disabilities or barriers that we face it. I think they should narrow it and be more personalized with each individual, probably maybe home visits or something like this, more into actions to go knock the door, just be, take the time, even can be a representative or wherever is in there, but just to be more approachable, to know what the community needs, literally have the conversation with you, because everyone is completely in different worlds and just to adjust, because I don't think so that is possibly profitable for the government just to keep people in benefits. to be honest, I will say honestly. So I think they have to put people into that productivity that we can just be useful for the society, for us as well, because obviously it depends. We can be like so many years, but what happened with us, no training. They should implement probably small courses, like it depends about your situation, just online, just double check like how you are, like, you know, maybe navigating through the system or digital skills. I think they should provide, or they should just have like a filter for you to request, at least if you're conscious, maybe for single mothers or mothers that they have kids, just to have that channel to say, okay, so there is any course or just in a different way, because probably you get lost with so many options that they have out there. But yeah,
I mean, in Southwark, I think maybe it's around 7% unemployment, but all of those unemployed people are not living in the same circumstances, and they haven't all been unemployed for the same period of time. They're not all facing the same challenges.
We all have different.
yes.
My problem is traveling and being in temporary is always a worriness. You know what is going to happen tomorrow.
Your accommodation is
yes,
temporary, right?
what is going to happen tomorrow? What is going to happen? Are they going to put me another place? And it's like constant. That by itself, you know, it's the stress, the mental stress.
But you're having to travel across the borough or
Yes.
out of the borough to look for work. And
Yes,
okay.
but I want to work where my borough, not the borough I'm living now, temporary, but because that's where I was working. So I prefer that, and more the community, because the one I'm living, they don't know I'm existing, because I prefer all my community is still there. You know, they don't. My kids, you know, their friends, all their activities there still, because I don't change it, because.
So it's another gap. It's another that's a geographical gap, and then you're talking about, you know, other ways that you can sort of disappear. And you are saying, Ola, that you feel unheard. Well, you've definitely been heard today. That's for sure. So
I agree with him.
Thank you for being here.
He's telling what I was about to say. He just
he made it clear.
I agree.
No, it's true. I mean, your experiences are so varied, but yet, you know, there are some points that clearly you do agree on. But I'm really glad that you came today to share your experiences with us and some very good ideas for what can be done in the future and how we can look at things differently in the future in order to solve these issues.
Solution and not only talking. We just want
Action.
Action for you and for many others who we couldn't fit into into the studio. Okay.
And I would say how relevant it is just to create those type of spaces, because if it wouldn't because of you and Sedulous, probably we wouldn't be here just expressing ourselves without filter, being honest and
venting.
No, it's appreciated. It is appreciated, and I'm quite sure that, you know, Southwark Council will be paying attention to what you're saying on behalf of the community. Thank you for being here.
Thank you.
Thank you.
Great.
Thank you.